Kerry believed before leading police in a wild chase near the White House yesterday. That chase ended with officers shooting the 34-year-old mother whose 1-year-old child was in the car with her. Friends and relatives have come forward saying Kerry suffered from depression, making this the latest tragedy be connected with mental illness. Today I spoke to a specialist in the field about why such things seem to be happening more often and the help that could be on the horizon. When there's a tragic incident that results in death, the individual behind it is often found to have suffered from mental illness. The shooting in Newtown, Connecticut, 28 deaths. Shooter Adam Lanza with a history of mental health issues. Navy Yard shooter Aaron Alexis killed 12 people and had complained of hearing voices. Just yesterday, chaos around the U.S. Capitol when 34-year-old Miriam Carey tried breaking through barricades and leading police on a chase that resulted in Carey being shot dead. She was battling depression.
Out of every 100 depressed patients, only 16 of them will be expected to improve with treatment.
Dr. Rudy Nottiger says that sobering statistic has nothing to do with an inability to cure or help those with mental illness, but rather their access to care.
There's not nearly enough services available for the people that need it.
Access to mental health care is often controlled by third parties, health insurance providers and the like. Nottiger says that can prevent or complicate the process of seeking help. While stopping short of calling it a perfect solution, he does find some hope in the Affordable Care Act.
There are some provisions in the Affordable Care Act that are looking more at integrated service delivery systems. So, for example, making sure that there's a mental health component available in primary care.
Nottiger points out that while the percentage of mental health patients with violent tendencies is low, the effects of those few can be devastating. He says the costs to provide care pale in comparison to the costs associated with letting mental health issues go untreated. He says, get over the stigma that someone seeking help is crazy and instead speak up and encourage them to do so.
I've had people sit in my office and say, I can't believe I'm talking to a psychologist. I thought I was stronger than this. There's still these kinds of biases that people have. Just making people aware is a good first step to helping them get to the point of getting some care.
Nottiger says, although it does appear we seem to be hearing more about violent acts by those suffering mental illness, he says there's also a greater focus on the connection than ever before, and it may not have seemed as important an element of such stories in the past.